So again, good afternoon to everyone. Welcome again for this afternoon session or synchronous session of our pathophysiology course. As we continue with the new topic, it is very much important for me as facilitator to consider an evaluation of what you have learned last time when it comes to our topic on chain of infection. We ended up with the topic on the periods of diseases and the chain of infection. Now we will proceed to the topic which is somehow connected with the chain of infection. And it is very important for us to be competent and have the skills when it comes to diagnostic examination. But before we proceed with the topic or the scheduled topic for today, I will encourage everyone to have the maximum participation uh, when it comes to the self-assessment exercise related to the topics that we have discussed last time. So since how many we are now? We are already 38, so 37. We are now 37 in the Zoom room. I may now consider at least 25 who may wish to attempt or who may have an attempt to answer the question. This is related to the chain of infection. The nurse attends to a client who is confirmed with typhoid fever after diagnostic evaluation. He is now considered as a carrier. Will it be infectious agent, reservoir, portal of exit, mode of transmission? Again, the nurse attends to a client who is confirmed with typhoid fever after diagnostic evaluation. He is now considered as a carrier. Letter A, infectious agent. Letter B, reservoir. Letter C, portal of exit. Or letter D, mode of transmission. So we may need 25 participants from the Zoom room to achieve our maximum participation. So we are now 19, so I'll start the count. 10, 9, 8, 7, 6, 5, so it's 21, 4, 3, 2, 1. So out of the 25 supposedly expected, we are having 23 who wish to answer the question. Moreover, we will take into consideration those who did not raise their hand. So out of 40, we are now 39. Out of the 39 who did not raise the hand, I would probably call Mr. Tyron. Mr. Tyron Romero? Tyron?
Sir,
Yes, good afternoon. What is your
good
answer to the
afternoon po.
question?
Letter A po.
Your answer is infectious agent. Thank you very much. So I may ask other students also if she will agree with your answer. So out of the 41 students we have now, so 40, okay, it's supposedly 40 because I'm the one counted as 41st participant. So let's call on those who did not raise the hand. May call on Okay, Miss Maria Erica Mahilum. Miss Mahilum? Maria Erica? Okay. So the answer is letter A. Okay, let us reveal the answer. So both of you agreed with each other to have letter A. But check again the question. The nurse attends to a client who is confirmed with typhoid fever after diagnostic evaluation. He's now considered as a carrier. So carrier. From the term itself, carrier, the infectious agent is already in a place wherein possibly it may temporarily live and multiply. So this is the correct answer. The correct answer is reservoir. Okay. If we're considering infectious agent, this could be if I mentioned that the nurse attends to a client who is confirmed with typhoid fever caused by Salmonella typhi. Salmonella typhi. So the Salmonella typhi is considered as the infectious agent. Now, if we're considering na po na the person is already a carrier, so we are considering reservoir, which we defined accordingly as a place wherein the infectious agent lives and multiply. So it could be, di ba, either a human, an animal, an object, okay, an object, or it could be soil. Okay? So next po. So thank you very much. Next question. Out of the 43, we're now 43. Out of the 42, okay, out of the 42 students, I may need participation po of at least higher, 40. Okay, we may have achieved 40 participants. The nurse assists the client who is already confirmed with rabies infection and concluded possibly of infected secretions. A. Infectious agent. B. Reservoir. C. Portal of exit. And D. Mode of transmission. The nurse assists the client who is already confirmed with rabies infection and concluded possibly of infected secretions. Will it be infectious agent? Reservoir, letter B. Letter C, portal of exit. We may need 40, portal of exit. And letter D, mode of transmission. So I will now count 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. Okay. So hoping the others po ay participating po so that for me to know, even if you will not participate or raise your hand, probably it may consider po the others po on the next questions po. So we are 30 out of 40. Okay. So now I may be calling pa rin po those who did not raise their hand. So may I call on Miss I'm sorry. I need to go back to that question. Okay. Where is it? So
Sir,
actually,
napakita na po
it
yung...
seems the answer was revealed because of the shifting. Okay. So meaning the others are saved by the inadvertent transition of the slide. Okay. So I'll just explain. Okay, my apology. I'll just explain why is it considered as portal of exit. Okay. As based from the question, the client is already confirmed with rabid infection. Now, we concluded possibly of infected secretions. So the secretions itself could be through coughing, through sneezing, through talking, or from any bodily fluids coming from the person with infected rabid virus. Now, we cannot consider it as an infectious agent because it was already confirmed. Once it is already confirmed, it may proceed to either reservoir onwards. But since it identified in the question related to infected secretions, so the portal of exit coming from the reservoir will be through the infected secretions. So that's why it's portal of exit. And we may not consider it pa as mode of transmission simply because it did not identify in the question related on how these secretions, okay, how will these secretions will be transmitted to a new host. Okay, so that's the rationalization behind that. Okay, let's proceed with the next question. Okay, with the next question po, I may need 35 students to raise their hand. 35 students out of 40 to 41 students. So we are now having 16. The nurse attends to a client with leptospirosis. From the patient's history, the client revealed the exposure of open wound in a blood. It refers to portal of exit, susceptible host, infectious agent, portal of exit. Again, I may need 35 student participants. The nurse attends to a client with leptospirosis. From the patient's history, the client revealed the exposure of open wound in a blood. It refers to A. Portal of entry, B, susceptible host, C, infectious agent, or letter D, portal of exit. So we need 35 and I'll start counting. 10, 9, 8, 7, 6, 5. We are now 32. 4, 3, 2, 1. I will have a deep breath. We need 2, 0. Okay. So we have 33 participants who raised their hand from the supposedly 35 expected students to have the maximum participation. So probably I may give chances naman for those who have raised the hand. For those who have raised the hand, may call on Denise Joy Dalmasio. Denise Dalmasio.
A po.
Okay, letter A. Thank you. So letter A is the answer. I will just again call another student if she or he will agree with you. For those who raise the hand, may I call on Miss Fides Papa? Miss Fides? Fides?
Dean.
Yes,
Good afternoon
go.
po.
Good afternoon. What is your answer to the question?
Letter D po.
Letter
D. Portal of exit.
portal of exit. Okay. So I will be calling another one again. Thank you very much, Miss Papa. I will be calling another one. Probably, may I call on Miss Prince Sakdalan. Prince, what is your answer?
Letter A po.
Letter A. Okay, thank you very much. So out of the 3 students who have answered the question, there are 2 students who have an answer of letter A and 1 student answered portal of exit. So let us reveal the answer. The answer is portal of entry. So I will explain to you why portal of entry. When in the question, it is mentioned that the nurse attends to a client with leptospirosis. So this is brought about by the infected urine. So yung infected urine of the reservoir, kasi ang reservoir ng leptospira ay mga rats. Okay, infected rats ng leptospira. Ang portal of exit ng wherein the leptospira will be out of the reservoir is this infected urine. So, yung infected urine na yon nagmixed with the flood water. Doon sa flood water na yon, it was revealed as mentioned from the patient's history that the client revealed the exposure of open wound. Eh di ba usually as we mentioned, ang mga portal of entry natin could be via the respiratory tract, could be open wounds. So these are the aspects that we consider for portal of entry. So it could be as mentioned po, it could be through the bodily secretions that are directly invaded in the body of the other person or the new host. So if we say susceptible host is not yet confirmed with the type of infection, simply because it only manifests 1, 2 or more signs and symptoms. So possibly, if the person have not yet confirmed, then the person could be on a medical treatment for confirmatory. So that's on the next na siya, kasi susceptible host na siya. If we are considering the infectious agent, so the leptospira is the one that is considered as the infectious agent, and as what I have reiterated on the portal of exit is based from the infected urine of the rat. So that is portal of entry. So let us now proceed with the next question. Our next question, I may need at least 30. Okay? So 30 students who may participate. Oh, ang bilis ha. We have already 21. Very aggressive ha. The nurse sends the client to isolation room after definitive test of COVID-19 infection. Transmission is concluded when contacted with infected secretions. What could be? Is it direct transmission? Is it indirect transmission? Is it droplet transmission or airborne transmission? We need 30. The nurse sends the client to isolation room after definitive test of COVID-19 infection. Transmission is concluded when contacted with infected secretions. A, direct transmission. Letter B, indirect transmission. Letter C, droplet transmission. And letter D, airborne transmission. So I'll be counting. So I'll just need 30, although we have achieved 30. So 31, 30. So how many are we in the Zoom room? We are already 41. Kanina 42, 43. So the 2 are missing. So I'll just check it later. So we are now 32. So I may be calling, since we have reached the maximum of 30, so I may be calling those who have actively raised their hand. So may I call on Miss Lara? What is your answer?
A po.
Your answer is letter A. Okay, thank you very much. So I may be calling another student po who may respond to the question. May I call on Miss Nicole Abelino? Miss Nicole, what is your answer?
A rin po, sir.
Letter A. Okay, so I may ask another one. Another one who have raised the hand. May I call on? Okay, Justin and Relano. It's Relano.
C po.
Letter C. Okay, thank you very much. So, from the question that we have, try to analyze the situation. Kasi transmission is concluded when contacted with infected secretions. So let us first reveal the answer. So there are 2 students natin who have answered letter A on direct transmission. Letter C is on the droplet transmission. So let us reveal first the answer. The answer is droplet transmission. Let us explain why is it droplet transmission. If we say direct transmission, the direct transmission is yung the transmission is direct physical contact. Direct physical contact. If we say direct physical contact, it could be via the transfer of blood transfusion. Second, another kasi yung vector transmission naman is brought about by insects. So sila vector transmission sila. Pero pag mga direct transmission, ayan, sa direct transmission, physical contact, direct physical contact, direct transfusion. So anything that could be directed to the circulation and through a physical contact is direct transmission. If we say indirect transmission, the indirect transmission is the transmission which the person acquired or contracted through infected objects or not infected, contaminated. Yan, contaminated objects. Those with from the portal of exit, for example, if it's saliva or any bodily fluids na usually that stays rather from an object, it's considered contaminated simply because if the portal of exit identified is through bodily secretions. Now, the airborne transmission is different from the droplet kasi yung airborne transmission, the person may be distant from each other, and the person spreads it as the microorganism, the virus, the bacteria suspends in the air. So aerial siya by aerosol. Pero ang droplet transmission, this we are talking na yung transmission is through infected infected secretions. So that is the key term for that, for droplet transmission. So thank you very much for those answers. Next, out of how many again? We are now 40. So we are missing the 3 students ha. Where are you going? The nurse attends to a contact tracing. The community could be high risk of being infected To break the chain, measures can be done except. So I may need 28 students to out of 41. 28 students to at least achieve the maximum participation if I will be calling those who did not raise the hand or those who have raised the hand. So the choices are the following. Is it diagnosis, antimicrobial stewardship, definitive testing, sterilization? The nurse attends to a contact tracing. The community could be high risk of being infected. To break the chain, measures can be done except. So we are only having 19 out of 28. But I will start counting po. We have 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. Okay po. So since we have only 22, nabawasan kanina, active na tayo. We are already 33. So nabawasan pa, 21 out of 28. So probably I will be calling those who did not raise the hand. So for those who did not raise the hand out of 40 again, supposedly kanina we are 43. So I may be calling those, okay, I may be calling Miss Ozawa, Maria Patricia. Miss Ozawa, what is your answer? Except, we're talking about except.
Letter A po.
Their answer is letter A. So to break the chain, measures can be done except diagnosis. Okay, let's see. How about for the other students? May I call on those who did not raise the hand? Chester Mendoza. Chester? Chester? Magandang hapon. So what is your answer to the question?
I'm not sure, pero baka letter B po.
Letter B?
Yes po.
Letter B, antimicrobial stewardship. We're talking about the except, ha? Except. Next po, I may be calling another, come again?
Except po ba?
Yes,
Ano po?
it's except.
Letter C po, sorry.
Letter C, okay. Thank you. I may be calling another one. So another one who did not raise the hand is, may call on Zaira Yu. Miss Yu,
Yes po.
what is your answer to the question?
Letter D po.
Letter D?
Po.
Letter D, are you talking sterilization?
Opo.
Okay, sige. So let us again analyze the question. The question is that of the nurse attends to a contact tracing. The community could be high risk of being infected, meaning high risk. It is not yet identified on the of having the infection. So we don't have the numbers, we don't have the persons who have been identified yet with the infection. So to break the chain of the spread of infection, measures can be done except. So diagnosis is definitely considered because we need to diagnose individuals in the community who may have the infection so that yung measures natin can be done. Kasi etong question na to is referring to the infectious agent eh. Kasi let us analyze the situation that the community still do not have the identified persons who are infected. So what could be the measure to break the chain of infection and spread of infection? So diagnosis could still be, di ba? B, antimicrobial stewardship. If we say antimicrobial stewardship, it could use the concept of prophylaxis. What do we mean by prophylaxis? Meaning, an individual will be given an antibiotic even without the diagnosis but suspecting for a possible infection for preventive measure. So it may not spread the infection. Letter C. Letter C is the answer talaga which kung hindi to except, this is the most considered. Definitive testing. So before diagnosis or before diagnosing the or confirming the clients or people in the community to have a certain type of infection, then definitive testing is very important. So ito yung number 1 if it is considered the most consideration. When it comes to the measures can be done except sterilization. Why sterilization? sterilization is not considered in this answer? Because eventually, when we already identify the type of infection, then we already identify those individuals, di ba? Those individuals who have already who will be considered already as reservoir, or possibly if it's human, animal, or any source, the sterilization is a procedure that can be done so that you can use utensils or things to prevent the spread of infection, because it's merely the procedure itself may lead to absence of any pathogens or microorganism. Which other than sterilization, we could have disinfection, right? Cleaning, yan. Cleaning, disinfection, sterilization are the three identified measures to break the chain for the reservoir. Second, this could be used also for the mode of transmission. So the answer is definitely sterilization. Okay? So I think, yan, we have another question. Another question, out of the 30, why we are decreasing in number? What happened? Please notify those who are leaving the Zoom room, ha. We are now 37, kanina we are 43. So why they are leaving the Zoom room? So anyway, I may check it through the importing of the attendance. Anyway, out of the 36, I may need at least 24 students, who may have the attempt or who may attempt to answer the question. Let us now proceed. The nurse attends to a client who is a carrier of hepatitis B infection. To break the chain, measures can be done: diagnosis, antimicrobial stewardship, definitive testing, sterilization. I may need 24 students to at least maximize the participation and have the decision if I may be calling those who raised the hand or those who did not raise their hand. So to have equal opportunity for the others to respond to the self-assessment exercise. So we are now 22 and we need 24. So I'll start counting. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. Okay? So we did not reach 24 because it's only 23. So I may be calling those who did not raise the hand. So let us now analyze the question first. The question, the nurse attends to a client who is a carrier already and has the hepatitis B infection. To break the chain, measures can be done by any of the following. So I will be calling those who did not raise the hand. May I call on Miss Hamandre Kaylin. Kaylin, what is your answer to the question?
Naririnig po ba ako?
Yes po. Magandang hapon.
Letter C po.
Letter C, definitive testing. Okay. So let's see. Next, I will be calling again. I'll be calling another student. If she or he will agree with you, may call on those who did not raise the hand. How about Ramon Reyes? Ramon? Carlo?
Hello po, sir.
Magandang hapon. What is your answer to the question?
Letter C rin.
Letter C. Okay. To break the chain, ha? Okay. Next, I may be calling another one. May call on those who did not raise the hand. How about Ronel? Mr. Villa?
Hello po, sir.
Apo, magandang hapon. What is your answer to the question?
Letter B po.
Letter B, antimicrobial stewardship. Thank you very much. So, among the three students, two of you answered letter C, definitive testing, and the other one, letter B, antimicrobial stewardship. Now, let us analyze the question. The nurse attends to a client who is a carrier. If we say a carrier, he or she, or it may be kasi considered as a reservoir kasi carrier na siya, carrier na. Now, on the perspective to break the chain for a person with hepatitis B at hindi siya mag-proceed to portal of exit at mode of transmission? Which of the following? So if we say A, diagnosis, the client is already confirmed with hepatitis B infection. So hindi na po 'yon ang answer natin. Letter B, antimicrobial stewardship. For antimicrobial stewardship po, since hepatitis B is viral infection and the person had been confirmed as having the viral infection, antimicrobial stewardship may not be useful on the situation of the client. So we may now only have letter C or letter D. Letter C, if you answer definitive testing, this is actually on the level of the infectious agent. Since the person is already a carrier and confirmed with hepatitis B virus, definitive testing may not be anymore anymore considered. So because it was confirmed na po, carrier na siya. So ibig sabihin confirmed na with the virus. So the answer of breaking the chain is still the same. The answer is sterilization. Sterilization. I just want to set an example. For example, the client with hepatitis B was subject for operation or undergone probably an operation. So probably there will be an exposure on open wound surgery, so there will be bleeding, okay, during the operation. So the blood itself could be in contact with the instruments that had been used during the operation. So since the virus can still stays and live for hours when it is contacted with a contaminated object through the secretions or through the bodily fluids such as the blood, then this could probably cause infection. So that's why sterilization could be used, kasi try to imagine if that instrument that had been used to a person who is infected with hepatitis B will be used again to another patient. So cleaning could not be one. It is just only by washing it by water. So and soap, that could not be sufficient of definitely preventing the cross infection. B, it could not be also disinfection. It may just only decrease or minimize the number of the pathogens. But we need to really consider po yung absence of pathogens. Why we need it? Because it's an operation and possibly the higher chances of having the transmission of infection. So the answer is sterilization. So I think I ended up with the self-assessment exercise. I hope you have been refreshed. I hope you have been refreshed with the topics that had been discussed when it comes to chain of infection. Now I will stop the sharing and we will proceed to the new topics for this afternoon. But for the meantime, I may ask the body, you may type 1 in the chat box if you don't have any clarifications or questions from the chain of infection. You may now type 1. So we have now 13, 14, 19 students who typed 1. If you don't have any questions, please type 1. 33. How about the others? So we are 40, 34. So you don't have any questions. 34. How about for the other 6, other 5, other 4? So we are 39, 37. So you don't have any question. How about for the rest, for the 2? Okay. So but anyway, majority of the students in the Zoom room do not have any question. So we will now proceed to the next topic pertaining to diagnosis. So I may just stop the sharing and proceed to the next presentation. So the next presentation is related to the diagnostic process. So I think I need to share, or you may now lower your hand. Okay, you may now lower your hands po. Thank you so much. Thank you very much. So now, we will be talking now on the topic which is related to diagnostic process. Okay. So I'm just checking the presentation if this is the correct one. Okay, but anyway, when it comes to diagnostic process, it is very important role of the nurse to be knowledgeable on pathophysiology and with the patient's history with the uh, verbalization of the clients as a primary data for the symptoms and observations and findings from physical examinations that were performed by the nurse. This could be used to evaluate the specific condition or health condition of the client. But for confirmatory diagnosis, the client may undergo the diagnostic process. So if we say diagnosis, this refers to identification of a specific disease through evaluation of signs and symptoms, laboratory tests, or tools. So aside from the signs and symptoms, the next topic that we will discuss na ay yung mga risk factors at saka mga signs and symptoms of various diseases. But eventually, it's very important po for a nurse to be knowledgeable of the signs and symptoms even though you are considering yourself na suspecting that the person may have this type of health condition. However, the specific identification of the disease to give a clear direction on the treatment regimen. Second, pharmacological management. Third, other than the treatment and the pharmacological management, it's to also to focus on the prevention of complications. Because once the client will be admitted into a certain facility, such as hospitals, specialty clinics, then uh, the nurse will definitely gather those data through observations and through interviews, but merely the concrete evaluation of diagnostic results will be the one that will have a clear direction on the nursing care management. So, what is the difference naman with the diagnosis and diagnostic examination? If we say diagnosis, it is more on the 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 impression of the person. Okay, the impression of the person based from the results of diagnostic examination. Kaya if we talk about diagnostic examination, this is to specifically identify the areas where to focus when it comes to the care management. Just like for example, when the patient had been admitted into the emergency room and have manifestation of fever. For individuals who are experiencing fever, we can associate this sign or a symptom on many diseases. So that's why it's very hard for us to have a clear direction of appropriate care management. So it may need further gathering of data so that to have the impression, the health impression itself on a direction to have immediate treatment to the client aside from the diagnostic examination. So because there are some diagnostic examinations that may not reveal immediately results because it may take processing of microscopic evaluation. It may take the processing of mixing it with specific reagents to reveal the results. It may need an expert or a specialist to interpret the ultrasound, the x-ray. So those are the some barriers which may delay results. But it is very important that diagnostic examination could reveal already results before managing the client. If it is for emergency, then the treatment could be symptoms based. If it has a fever and still no diagnostic examination yet available, then it could be symptoms based yung management. So probably it managed first the fever. If the patient has cough or difficulty of breathing, then the patient the patient will be managed accordingly to the problem with difficulty of breathing. But as to whether the client is having difficulty of breathing, if the problem, kasi it's related to ventilation and respiration, then we can conclude immediately if the patient is experiencing a problem with carbon dioxide or a problem with oxygen, because both situations, either toxicity or problem with ventilation of these gases that are processed in our body, may have similar signs and symptoms. Now, if we will gear towards the direction of what specific system will focus on the treatment related to difficulty of breathing, eventually probably will focus on the respiratory tract. Pero eventually, there are also concerns that a person experiences difficulty of breathing. It's only secondary if there is a major organ that is affected. Just like as what I have mentioned before, we have the acid-base balance, which the kidneys are the ones also contributing to the status, to the respiratory status. The heart can also have a direct effect to the respiratory status. The brain can also have a direct effect to the respiratory status because of the medulla oblongata or specific part of the brain that is in control with respiration. So we're still in limbo on how we could have the appropriate management. So probably the nurse can manage initially with the vital signs, specifically with the pulse oximetry. And if ever the client reveals for a problem or deviation in the oxygenation, then we may, for the meantime, while waiting for diagnostic examination, manage on the oxygen supplementation. But if the client verbalize that the difficulty of breathing, the client does not have any history of chronic obstructive pulmonary disease, then the client usually experiences difficulty of breathing at the peak of anxiety. Then think it over, because possibly the client is not experiencing a problem with oxygen. The client is experiencing a problem with carbon dioxide level. So that could be a different management. So that's why for a nurse, it's very important to be keen observer and at the same time have the presence of mind and alertness when it comes to the management of clients while waiting for diagnostic examination. And while waiting with the diagnostic examination, this could direct to diagnosis of the client. That's why when the client had been admitted or will be admitted in the emergency room, it may start first with the primary diagnosis, the working diagnosis. But sooner or later in the succeeding days of hospitalization and upon discharge of the client, there could be a possibility that it may change upon the series of the manifestations and diagnostic tests that can be done to the client. So still, the nurse can continue care management while waiting for these results for symptoms-based management. Now, diagnostic examination can give us the idea of identifying the individual specific areas. That's what I have mentioned to you. When the client experiences difficulty of breathing, it could be a result of a problem with kidney, it could be a result of a problem with the heart, it could be a result of a problem with blood, it could be a result of a problem with the brain. So which of these major organs we will direct the management so that to manage difficulty of breathing. There could be a possibility then that the problem is directly a concern with the respiratory tract. So that's another one. So usually we considered initially a priority diagnostic examination. Just like if, for example, complete blood count is an initial test to specifically identify the problem with infection, with inflammation, a problem with blood clotting, a problem with specific bacterial infection or viral infection. So that's why usually when the client had been in the emergency room, it's always standard natin to have the complete blood count. So if it is related to the urinary system, then eventually the client will be subject for the urinalysis. And next is if the problem is more on the GI tract and the client is experiencing diarrhea or problem with the bowel discomfort, then probably the client will be subject for a stool analysis or fecalysis. on this perspective, this will give us the idea on what to focus also when it comes to pharmacological management, because we have been oriented in pharmacology that antimicrobial may have a different action with antimicrobial could have a different action with antiviral. Another concern is we need to take into consideration that if the client is pregnant, then a nurse must consider precautionary measures. So that's why diagnostic we cannot give immediately medications to pregnant client simply because they could be high risk for situations that may affect the fetal well-being, or it may cause a problem when it comes to risk of the fetus. So these are diagnostic examinations. So when it comes to diagnosis, we are referring to the evaluation of signs and symptoms, okay? And based from the laboratory test. If we say diagnostic examination, we are referring to identify the individual specific areas of problem, either a weakness or strength, in order to determine the condition. Now, let us identify the importance of diagnostic parameters. Actually, we have four importance of having importance of diagnostic test parameters. Number one, it's for diagnosis. So obviously, first is to identify the specific disease. Okay. Now, for example, the client experiences loss of consciousness. If the client experiences loss of consciousness, let's go back to the foundations of anatomy and physiology. So the consciousness are anchored actually with the function of the nervous system. And with the function of the nervous system, it is eventually on the part of the brain. Now, on the part of the brain, then the next question is, since it considered loss of consciousness, we do not know what specific part of the brain or what made the client experiences loss of consciousness. So definitely the nurse will do patient history. The patient will observe the signs and symptoms other than the loss of consciousness. And another is for diagnostic examination. So if the person is having loss of consciousness, then probably the person will be subject for the evaluation of the brain. So what could be the possible test? It could be CT scan, it could be MRI or magnetic resonance imaging, or computed tomography or CT scan. If the client revealed from the patient history that the client had experienced the head injury, so probably X-ray. So those are the tests which even the doctors may not have their orders. The nurse can initiate specifically and prepare the client for that specific test, because eventually this may give us the idea of what could be the part of the brain that is affected and could possibly determine the diagnosis of the client. So that's why for the specific disease, when the patient had loss of consciousness and it actually focused on the function of the brain, possibly, for example, if it revealed on the CT scan, and try to imagine, a person can be subject for CT scan, it need to test first the kidneys. So can you imagine that? Because eventually, a person who may have the CT scan may receive a dye that will be administered to the client intravenously, so that to facilitate checking of the problem with the specific blood vessels to the brain, or areas or spaces in the brain that are affected. It may reveal a problem with tissue death. It may reveal a problem either with bleeding. So that may identify in the CT scan. But when it comes to the magnetic resonance imaging or MRI, in the MRI, it can identify the specific condition of tissues and blood vessels. So those are the different examinations. But however, what is the easiest and what could be managed to have the results immediately? So we will look for an examination such as chest X-ray if there is a problem with fracture. If it is not chest X-ray, head rather, the skull X-ray. The skull X-ray if there is a problem with the fracture. If there is no problem with the fracture, then eventually the client will be subject for a CT scan. And if they're ever needed to have evaluation of problems, for example, of the specific blood vessel, which cannot be seen by the cannot be evaluated in just CT scan. So the client will be subject for magnetic resonance imaging. So in chest X-ray, in the skull X-ray, it can only identify a problem with skull fracture. When it comes to the CT scan, it can identify a problem if the concern is related to a dead tissue in the tissue death in the brain or a problem with bleeding in the brain. So that's why if there are results like that, usually it is associated with cerebrovascular accident or stroke. Now, when the client is now for the magnetic resonance imaging, which will evaluate the specific blood vessels and tissues. So those naman pag MRI are conditions na if we are suspecting a problem with aneurysm. Okay, aneurysm that specifically affects the blood vessel of the brain, or if there are ruptured blood vessels already. So if a nurse is really aware of the basic foundation of the functions and processes of the systems of the body, she or he could be directed na on the specific disease. While waiting for that disease, we could identify specifically the immediate management. Kung for example, the patient may have loss of consciousness. If the patient may have the loss of consciousness, then primarily the nurse will The nurse will check vital signs. From the vital signs of blood pressure, cardiac rate, pulse rate, this may easily determine. This can be easily determined because we could use only the the aneroid, sphygmomanometer, or we could use the pulse oximeter. We could use only the stethoscope, and we could reveal the vital signs. So on these results, it could give us initial or primarily a database for us to initiate the care management. So symptoms based tayo. So, kung loss of consciousness, tapos talagang the person, as you check, has no verbal response, has no motor response, will we need to initiate the cardiopulmonary resuscitation? So that's another phase. Kasi for example, I will not do anything because the patient or the client will still be subject for ultrasound, rather for CT scan. The client will be subject for the MRI. I will wait. No, you cannot wait for that. So you may start first with the initial gathering of the data. However, the importance of diagnostic tests, you may not wait for that, but specifically this diagnostic test will be ordered on the early phase pa lang while you are attending to the symptoms-based management, so that in the long run, if you could have the results, you could have now the specific focus on the disease. Next po, there are some situations din po tulad niya na, for example, ang impression while the client is subject for CT scan, we are having the impression of stroke, but we do not know if the client's stroke or cerebrovascular accident or CBA is related to bleeding, or is it related to tissue death, or what you call infarction. So that is now that two findings of stroke may have different management. Although it is centralized in the brain function, but two management are different with each other. Is it either bleeding, or is it either a problem with tissue death? These are two different things. Now, to make diagnosis or to exclude possible illness, for example, it was suspected that the patient may have stroke. So that's why there is some diagnosis na CBA, infarct, or bleed. Ibig sabihin, it could be cerebrovascular accident or stroke, but still on the process of either bleeding or either with infarction or tissue death. So if the patient will have the results, or the healthcare team will have already the results, and it will reveal that the client is having bleeding, so we will get away na from the problem with infarction and focus na on the specific area, on the stroke of the patient that is caused by the problem with bleeding. Okay? So next po, the importance also of having the diagnosis or diagnostic test parameters is to have the appropriate treatment. So the specific diseases have been identified. So we exclude some of the theoretical assumptions of the condition of the client because of the revealed diagnostic examination. Now, we will consider now an appropriate treatment. This will also give us the idea, for example, we are suspecting the client is in the emergency room and complaint of right lower quadrant pain. So usually pag mga right lower quadrant pain, anong iniisip ninyo na usual na affected diyan? Pag right lower quadrant. Can I hear response from the students? Anong mga usual that you are thinking pag kami mga right lower quadrant pain? Yes, Miss Lara.
Appendix po ba, sir?
Okay, so that probably there is a problem with appendix or appendicitis. Any other assumptions that you may think of na pagka nag-right lower quadrant pain yung pasyente? So probably, ayan, si Miss Lara will think na, okay, magpo-focus na ako on the assessment if the client is already having a problem with appendicitis. So another is, ano pa ba ang mga adjacent organs aside from the appendix? Kasi since nasa intestine siya, so probably pwedeng nasa right upper niyaan ay nandoon ang liver. So possibly then na it could affect specifically kung nagra-radiate at the back, pwede ring pwede ring a problem with gallbladder. So those are mga possibilities kasi what made you think na yun yung mga possible organ and what made you think na appendix yung problem? Because of your knowledge when it comes to the anatomical structure, yung placement ng organ. So that's why usually pag mga right lower quadrant, you will think of appendicitis. Now, so syempre the patient comes to the emergency room suspecting for appendicitis. So how can we check infection? So actually this is usually caused by infection and inflammation kasi appendicitis, itis is associated with inflammation. So on that note, the client will be checked on the level of inflammation and on the level of the inflammation and infection. So probably the client will initially have complete blood count kasi in the complete blood count we can identify infection, we can identify level of inflammatory process. So other than that is we could facilitate the client or subject the client for urinalysis. Kasi sa urinalysis then this could be connected in the perspective then na baka hindi siya sa appendix ang affected, baka affected naman, it's related to the kidneys. So checking also of the urinary tract. So on that note, let us with those results of CBC and urinalysis, we can check yung direction initially if it's concluded with appendicitis. Sir, paano naman po if it's already painful na and usually the nurse might think na baka mag-rupture yung appendix kasi once mag-rupture ang appendix, this could really lead to bleeding. Other than that, this could lead kung infected yung appendix, this could lead to the spread of infection throughout the circulation. So very fatal. Pwede siyang maging fatal. Pag nag-spread yung infection, so magiging sepsis yon. So usually pag ang patient natin while waiting for the CBC, titignan yung complete blood count at tapos mataas yung WBC, there's infection, tapos there's also a sign. There's also sign na merong inflammations in the differential count. So kung ikaw nurse ka, nako baka it's probably appendicitis. So there are also other tests to check if it is already appendicitis. So probably the surgeon may have an emergency appendectomy because of the preventive surgery ito para hindi mag-rupture yung appendix. But on the perspective of the specific disease, so CBC and urinalysis will do sa diagnosis, we can get away from the other thinking na is it related to gallbladder, kaya sometimes ang client will be subject for the many diagnostic examinations to validate yung specific disease. So for example, if there are no diagnostic tests that could be related for gallbladder, okay, let's get out of the problem with the gallbladder. If the urinalysis is clear, then we'll get out of the urinary tract. But if in this complete blood count there are results that may reveal on a problem with infection and a problem with inflammation, ayan, so probably it could lead to a possible appendicitis na yan. So ano yung naging appropriate treatment? So since it is emergency and it is based from the diagnostic results, so the client will be subject for appendectomy. So that's the surgical treatment. And while the patient is having the surgery, the patient will have a confirmed diagnostic examination, di ba? Pag yung appendix ay na-remove na, tapos will be subject for the pathological test. O halimbawa, the client will be what do you call this? It will be subject for surgical pathology. So pag sinabi natin di bang surgical pathology, the appendix, the tissue of the appendix will be tested for the definitive diagnosis. So pag cytopathology, ang i-check naman is yung cells. Pag microbiologic pathology, it's all usually on the deeper perspective sa chemical level. So there could be a possibility that there could be a secondary test while having the initial test. Kasi pwede ring mag-ano yan may considered as baseline and we can consider it as the comparative. Why is it that we need to have repeat test? Kasi kung for example, the client had appendectomy already. Why is it that the client will still be subject for another complete blood count? Simply to check if even though the managed could be prescribed with antimicrobial, but it will still consider if the level of infection had been managed through those measures, the surgical treatment and the pharmacological management. So this is referring to the diagnosis. It is very important. It is a very important parameter po ang diagnostic test simply on specific disease, to exclude possible illness. And third, for diagnosis is appropriate treatment, and it could be another supplemental test for confirmatory or definitive testing. So next po, the importance of diagnostic test parameters when it comes to monitoring. Okay, when it comes to the monitoring, ang very important when it comes to monitoring is the intention to see if the disease is controlled. Okay? If the disease is controlled. This is usually related to mga comorbidities. Ayan. Yung mga comorbidities, ibig sabihin, for example, those patients na may mga lifetime comorbidities na. Anong mga examples nyo ng mga lifetime comorbidities na? The usual situation that the client is taking na mga maintenance drugs. Anong mga situations ito?
Diabetes and high blood po.
Very good. Diabetes and hypertension are the most common. Okay, the most common. Although, when it comes to diabetes, aware tayo that this is considered as chronic disease. Why is it chronic disease? Kasi if a person has diabetes, there must be a continuous checking of blood sugar level. Kasi for example, there are some situations na ang diabetes is dependent on insulin, di ba, administration. So, there is a need also to check every now and then the level of the blood sugar, if it is still manageable or if it is still need or necessary to administer insulin. If it's not, or if it's controlled already, insulin may be discontinued. This could be also a way to discontinue medications. So for example, hypertension naman. Sa hypertension, it could be associated with many diseases na pwedeng maging complications. However, for hypertension, this may need control, pero we need to check the cause of the hypertension. Can you give me examples na pwedeng mga factors na mag-contribute na itetest? Ay, ito na lang, specific. What could be yung mga possible tests if the client is having hypertension? What are those usual tests na sinasubject for diagnostic evaluation if the patient is hypertensive? Anyone?
Lipid profile po.
Very good. The lipid profile. Why lipid profile? Simply because the cholesterol itself could be, or the lipid profile, the lipid itself could be one factor that may block blood vessels and may aggravate hypertension. Ano pang mga tests yung possibly that we may consider for those who may have hypertension? Do you know ECG?
Yes po.
Yeah. The electrocardiogram or ECG could be a test so that to specifically identify ito sa conduction activity of the heart. Kasi posibleng the cause of the hypertension is a problem with the conduction activity of the heart. And through that conduction activity, it can, if it has deviation, it could already identify what's the cause of the hypertension from a specific diagnosis. Aside from diabetes, blood sugar, aside from hypertension, can you think of other conditions na may need monitoring and may need diagnostic test results?
Sir, sa uric acid po.
Very good. Thank you so much. Kasi 'di ba, may mga situations po tayo na ang uric ito po, ayan, tama po kayo. It's considered as a chronic disease kasi it must be controlled. So if it may not be controlled by, for example, sometimes we may have problems with the nutritional management at napataas ang mga food that is high in the purine. So ayan, there is a attack of the arthritis. Okay. So eventually, what could be the test? So syempre, yung level of uric acid. Pero it is not just only the level of the uric acid, but also to check the kidney. Okay, the kidneys. So it could be creatinine, it could be the BUN, the blood urea nitrogen. So yun po, that will certainly, and the level of uric acid, that could identify the results of the kidney and other than the uric acids. Ayun, very good, very good. Any other conditions that somehow lifetime na siya, for example, if the person had been diagnosed and lifetime na siya and may need continuous monitoring. So I receive a response.
Ano po, yung
Yes.
sa fatty liver po, yung SGPT, SGOT po.
Okay, very good. Yeah, very good. So when it comes to the liver, kasi kung for example just like me, I can set an example yung experience ko. I do not have any more gallbladder. So nag-cholecystectomy na ako. So the higher chance that I could be high risk for fatty liver. Okay, I can still I can still manage to eat food with fat content, but the high risk could be a fatty liver. So that's why this could test also my liver, a regular checking of my liver for purposes of monitoring. So because that is an expected complication. So I think Ms. Dalmacio answered cancer. That is also correct. Kasi if for example, 'di ba ang cancer po may leveling 'yan, 'di ba? Kung stage 1, stage 2, stage 3 and stage 4. If the person had been diagnosed with cancer, so check natin, 'di ba, what are the things that needed to be checked? If it metastasized already or spread to other organs or tissues of the body. So this must be controlled. So ano yung pang-control natin doon? So yung pag-control natin doon, if the client had undergone the chemotherapy, pero still the client will be subject for the test. So that to compare, if the client managed to had been managed accordingly with chemotherapy or his or her condition is improving. Pero kung for example, the client is having chemotherapy from stage 1, nag-stage 2, nag-stage 3, this is for purposes of what appropriate action or treatment must be done. So that's part of the monitoring. So kasi kinokontrol natin eh. So we need to control it on stage 1 or have full recovery. Yun yung goal. But if it aggravates yung stage, that's another direction of how the person will be treated. So ayan, very good. Good answers. Very good answers when it comes to the relationship, when it comes to the monitoring. Kasi it's the purpose of monitoring is first to control. Second is to consider mga chronic diseases na it could not be treated in 24 hours but the person already carried it for lifetime. Okay, thank you very much for those responses. Next is we have, other than the monitoring, is related to the importance related to screening. Okay. When it comes to the screening, there are signs and symptoms, for example, na we are not familiar with. Kaya that's why if you will consider po yung before, during the pre-pandemic, when signs and symptoms of difficulty of breathing happen with individuals, we just suspected that the person has only flu, the person may just only have upper respiratory tract infection, but our observation goes that why is it that there's a sudden critical condition even though it started with the upper respiratory tract infection? So it become a hanging question during the time of the start of the pandemic. So that's why and during the time the spread is very fast, that infected the other individuals as well. So ngayon, if we are considering po to identify those individuals who have been infected, so we really need to identify what the test could be. Kaya that's why during the time na wala pang RT-PCR test, there is no antigen test, ang usual test that the patient have is X-ray. And they started to connect it, yung result ng X-ray, with pneumonia. So that's why pneumonia had been identified as a complication of COVID-19. Pero sometimes yung epidemiological unit, pag sinabi natin epidemiological unit, ito yung nag-i-study ng large group of the persons who have been infected. So yung pag may mga observations and reported incidences of individuals or groups that have similar signs and symptoms. So if it is a large group, this is for purposes of screening. That's why it came out na yung mga testing for RT-PCR, testing as a gold standard, which will identify the test. Yung before nga, we are not subjecting the client to antigen test because it can only identify the active, yung active infection, but it may not identify the previous infection. So that's why RT-PCR can identify in any phase of within the 14 days. So sabi nga, di ba, we have heard about na it may give us a false negative or a false positive because of a certain situation nga na kung for example, if the client had been exposed and the patient's incubation period must be 14 days, tapos nagpa-test pa lumabas pa yung signs niya and signs niya on the 10th day. So what happened to the previous 10 days? So nag-negative na siya. Pero eventually pala dun sa first days, kahit first few days, even though the person is asymptomatic, nag-positive na pala siya doon. So yun yung mga dilemmas and questions that have been addressed. So that's why it put to the preventive measure for screening na aside from the X-ray before, it put to the perspective of having the RT-PCR test, we have the antigen test, we have the saliva test, so that this could facilitate the mass testing. Kaya nadinig nyo before din yung word na mass testing, so that it could identify those persons who are infected, lalo na pag ang observations na nung flow of infection ay affecting groups na already. So first, if we review the importance para diagnostic parameter, first is related to the diagnosis. Okay, number 2 is related to monitoring. To number 3 is related to screening. Okay, so this is related, pag screening mga large segments of the population po. And usually its purpose is to identify infected individuals so that they could be isolated, they could be subject for quarantine. Ayan. So this may not just only apply for COVID-19 but also for the infectious diseases. Okay, next po, prognosis. Okay. What does prognosis mean? So ang diagnosis po kasi is yung existing condition will be tested, then diagnosed. If we say prognosis, the prognosis is yung possible direction when identified and diagnosed, what could be the direction of the health condition of the person after a week, after months. So usually this concerns is like it allows the clinician to consider po of developing a disease in the future. Kaya usually pag prognosis po, diagnostic test parameters could prevent specific complication. That's the point. The diagnosis can give us the data of confirmatory test. Yung prognosis naman to prevent complications. Okay? Kung ang person is having diagnosed or had been diagnosed of stage 1, then then on the certain type of cancer, based from the literature and studies, mabilis mag-develop. For example, let us have the breast cancer. Sa breast cancer, pag stage 1 yan, since highly nodular ang breast, mas mabilis mag-cause yan ng spread of the cancer cells. Kaya that's why some of the experts or the doctors suggest to have already mastectomy or removal of the breast, because from stage 1, eventually it may spread faster at mag-lead na yan sa stage 2 and may affect the adjacent organs. So that's why as a prognosis, kung breast cancer yan, then based from the literature na mabilis mag-spread ang cancer cells, based from the literature ng breast cancer diagnosis, yun. So yung prognosis niyan is the client will be subject for mastectomy. Preventive siya. Preventive. Pag hindi, if the patient may not undergone this specific treatment or surgical procedure, then the higher risk na pwedeng mag-stage 2. So yun na yung prognosis. It gives us a direction kung if the client could be high risk for the metastasis or spread of cancer cells, or if the client will be subject for a surgical procedure, mas mape-prevent. So what could be the chances of the client for recovery? That's also prognosis. So usually, ang prognosis din po ay consideration po natin for patient's predisposition. If we say patient's predisposition, for example, why you are being asked of having familial history of certain diseases. Kasi pag sinabi nating familial, it is genetically acquired. Okay? Di ba most of the time pag tinanong kayo, do you have any history of cardiovascular disease? Kasi most of the cardiovascular diseases could be acquired. Okay. So for example, for pregnancy naman, for pregnancy yung may possible findings dun sa newborn, ang itatanong sa mother is if the mother engage into a lifestyle concerns, or if the patient took medications during her pregnancy, or having some abuse when it comes to substance abuse, which yung possibility na the client has the newborn has the congenital defects. So we'll go back to the history of the mother during pregnancy. But on the prognosis naman, if the person, for example, nag-lead sa congenital heart defect. So sa congenital heart defect, sa newborn, ayan na, titignan na natin. Paano natin malalaman kung congenital heart defect? So kung congenital heart defect, so there will be series of tests. So pag considered na siya as congenital heart defect, if the patient, if the newborn could be subject to a surgery, then there is a greater chance of recovery. But if the client will not be subject for an operation or a certain operation, so ito naman po yung chance po that the newborn will survive. So yun lang po yung tinatawag nating prognosis. Other than that is yung mga sinasabi nating mga genetic test na possibility that, for example, if it runs to your family ang diabetes, then possibly the next generation may have also diabetes. So that's why on the prognosis, you need to check eventually the baseline for blood sugar, or possibly you may engage yourself to annual physical examination. So these are the situations of why do we need to consider the diagnostic test parameters. So before we proceed with the first one, let us have a review of the importance of diagnostic tests. So number one, the purpose is for the for the diagnosis. Number two is related for monitoring. Number three is related for the other than we have the screening, and number four is related to prognosis. So we have explained its importance, and now we will proceed to a very common diagnostic examination that we encounter every time that we attend to clients. Okay, so let's start with the let's start with the complete blood count. Okay, in the complete blood count po, this is a group of tests that evaluate the cells that circulate in blood, including the following. So we have the red blood cells, we have the white blood cells, and we have the platelets. So these are the three common components that are being tested with the complete blood count. And if you will see on the projected screen, we have a different structure of the RBC, and this is obviously the WBC, and these are the microscopic evaluation of platelet. So that's why when one blood specimen had been tested, the count is merely identified based from the structure and characteristics of each cells. So as to give you an overview, pag red blood cell, probably we considered dito sa red blood cell as to yung level of oxygenation and blood consistency or viscosity. Pag white blood cell, we're considering a parameter related to infection or inflammation, at saka pag platelet naman, we're considering yung clotting. Okay, yung clotting, blood clotting. Kaya that's why pag may problem tayo with red blood cell, this is usually a response if the client lacks oxygen. Pag white blood cell, this could identify specific parameters if the client will be subject for an antibacterial, an antiviral, or probably an anti-inflammatory drug for pharmacological management. For platelet, this could identify if specifically if the client may have a blood transfusion, same with RBC, or possibly it could consider also mga drugs that is or that are directed on the clotting action or the action of clotting. So now let us review what complete blood count is. So pag sinabi nating complete blood count, usually the nurse may need to prepare and explain to the client prior to the purpose of why having the complete blood count. If the client will be subject for complete blood count, it could be with or without differential count. Sir, what is yung with and without differential count? Pag without differential count, it may just only identify results of RBC, hemoglobin, hematocrit, WBC, and platelet. If the complete blood count is with differential count, then that follows through yung tinatawag nating other results to validate a problem with inflammation, with infection, with the blood clotting or bleeding. This could identify either eosinophils, basophils, which could be later discussed, eosinophils, basophils, neutrophils, lymphocytes, segmenters. Those are the components of the differential count. What is the advantage of having the differential count? The advantage of having the differential count is if it's for example, we are referring to WBC, and if it is elevated, elevation of the WBC can give us the idea that the body is responding against infection or inflammation. So the next question is, sir, how can we know if the problem is with the infection or with the inflammation? So the differential count may direct you. So another, sir, paano po if, for example, the client, we are suspecting for a client on infection, but how can we know if it is bacterial or viral? So that could supplement yung results sa differential count to specifically identify yung direction and appropriate management if you will be on the bacterial or on the viral management, infection management. Okay, now how it is collected. So usually the blood is being collected, although there are some nurses who are phlebotomists, but however these are the role of yung tinatawag nating mga laboratory scientists or medical technologists. So usually the extraction of the blood is venous, okay, venous blood, and collected in a lavender tube, okay. Usually po ang lavender tube, ditong tube na ito or test tube, okay, is a specialized tube that may have an anticoagulant EDTA. So pag sinabi natin anticoagulant, kasi usually 'di ba ang response ng blood pagka lumabas na siya of the blood vessels, nagka-clot na siya. And plus yung anticoagulant that is contained in the lavender tube are the ones to maintain the consistency ng blood and qualify for testing pa. So class, once if you will be the one as nurse, if you will be the one who will send the specimen to the laboratory, it should be thoroughly mixed. So wag niyo masyadong iano po yan ha. Wag po masyadong kasi yung sinasabi natin it should be thoroughly mixed. Yung when the blood is already in the tube that has the anticoagulant EDTA, it should thoroughly mix para po hindi mag-cause ng clotting. So, yan po ang itatanong ninyo when you will be collecting blood. Tatanong niyo po sa laboratory scientist po or medical technologist, does the tube already contain an anticoagulant po, EDTA? So, pwedeng hindi siya EDTA but anticoagulant that will simply prevent yung clotting ng blood specimen mo. And usually, kung for example, later ko na idadalhin sa laboratory, ilagay ko muna sa rep. Lalo na if you will put in the rep, it will cause the clotting of the blood. So it may not be acceptable for testing. And possibly may cause the clotting pa nga pagka in a temperature that may cause the freezing of the blood. Kasi ang problem niyan, pag nag-freeze yung blood specimen mo, yung mga cells mo may not be anymore viable for testing, for microscopic evaluation. So when is the time na unacceptable na ang specimen? Unacceptable na po ang specimen if it is already clotted. Makikita nyo naman sa tube, pag masyado na siyang clotted na siya, at yung specimen po ay almost 2 days na. It's 48 hours old. Okay? So this will not be. So that's why whenever the client were subject for blood extraction, for complete blood count, it must be submitted agad or sent to the laboratory for testing because it could lead to later time pa of the submission to the laboratory, pwedeng ang chance po ay mag-clot, and this could not be anymore valid for testing. Okay. Now, let us now start on the red blood cells. As we review before, yung tinatawag nating anatomy and physiology, the red blood cell is also called as erythrocytes. Okay. Ang erythrocytes, as we go back to our learning in the anatomy and physiology, this is usually produced sa bone marrow at nagmamature siya sa bloodstream. Again ha, ang production niya sa bone marrow pero nagmamature siya sa bloodstream. Okay. Usually ang span of the erythrocytes ay 120 days. Ang span of life ng erythrocytes or red blood cells. And usually ang level po nito ay 4.5 to 5.5 million. And later on, we will interpret paano po sir kung mababa ang red blood cell, paano po kung mataas ang red blood cell. Then later on, we will interpret it. And as nurses, it's very basic for all of us to have the basic interpretation of it. So what are the tests na could be measured when it comes to RBC? It could measure yung tinatawag nating total red blood cell count or RBC. It could measure hemoglobin. It could measure hematocrit. It could measure mean corpuscular volume, which later will be discussed. And it could measure red blood cell distribution width or RDW. Sooner or later, you may encounter, ang most common lang kasi na encounter ninyo is the RBC, hemoglobin hematocrit. But what is the importance of having the MCB and the importance of RDW? So let's start with the hemoglobin. Okay. Sa hemoglobin concentration po, usually we are aware that the 90% actually of the RBC is 90% component. Ang hemoglobin po is the one that carries the oxygen molecules. Okay? So yung oxygen molecules, kaya very important po ito for us to specifically identify yung level of oxygenation. Although by peripheral sa pulse oximeter, we can already identify the oxygen saturation. But basically, to have a serum test that will give us the actual oxygen level in the blood. So we have, as mentioned, 90%, at usually ang hemoglobin po in the peripheral blood represents yung mini-measure niya ng 90%. So here comes the common findings. Pag mababa of there's decrease in hemoglobin concentration, the patient could have anemia. And increase in hemoglobin concentration, the client may have polycythemia. So what is the term? What is the term used here to basically connect it with blood? Yung term na anemia. Anemia is always associated with blood. Now, when it comes to decreased hemoglobin and hematocrit, it is expected na pag mababang hemoglobin, since basic component siya ng RBC at 90% siya ng RBC, then expected also that yung general result ng RBC are also lowered. But for us to identify kung what is the cause of the problem with the decreased level of hemoglobin, then that could lead to another test probably. So ang decrease in hemoglobin is anemia, and the increase in hemoglobin concentration is polycythemia. So anemia, this is usually considered po na pagka ang patient is anemic, then probably the nurse knowledge here is there is a lack of oxygen that circulates the body. So that's one. So pag polycythemia naman is increase in the hemoglobin concentration, ang usual problem naman nito, yung oxygen level mo is above the normal reference, that could also lead to oxygen toxicity. Kasi pag oxygen toxicity naman, this may lead to the dryness of the tissues and mucosa, which could also lead to damage. So anything that is sobra may lead to eventually toxicity and may cause harm or damage to tissues. Any questions so far? Any questions so far? So hearing none, so I may proceed to my next slide. Let us now proceed naman to hematocrit. Sa hematocrit naman, kung kanina ang level po sa hemoglobin, we are measuring the oxygen. Now sa hematocrit, we are measuring the volume. Okay? Kung ang hematocrit po ay decrease, then low volume of blood. Pagka-increase naman ng hematocrit, increase volume of blood. So it's just a point of, kung for example, sir, if RBC is decreased, hemoglobin is decreased, anemia. Now, if hematocrit is decreased, we're considering findings of hypovolemia. So clear po tayo doon, no? So lower volume of blood, decreased oxygen via hemoglobin, obviously RBC is decreased. So pag high hematocrit concentration naman, ang term naman dyan ay hypervolemia. Okay, too much concentration naman ng blood, which could be harmful din. Kasi pag too much concentration ng blood, this may cause the possibility of the obstruction and delay of the circulation sa body. So let us now identify what are the findings pagka decrease ang hematocrit concentration. First is loss of blood. When is the time that you may expect loss of blood, massive loss of blood? Example, even in your menstruation, kung too much ang kung profuse na ang menstrual flow at too much profuse na ang bleeding, you may not just only suspect it's a normal menstrual period, but you may be checked also when it comes to hematocrit level, at kung ang findings niya ay lower ang hematocrit concentration, you may suspect that there is already blood loss. Another, those who have experienced miscarriage or abortion, sila po ang posible na pwedeng merong blood loss. Another, major injuries, for example, stab wounds. For patients who may have stab wounds, kaya class, whenever there will be penetrating wounds which is caused by stabbing, then you must not remove the foreign object, or kung any foreign object that penetrated the body, you must not remove the object kasi once you remove it, then that it may cause the internal bleeding. So usually yan, pag mga stab wounds po, internal bleeding, loss of blood, expect low hematocrit concentration. Another po, since may mga tinatawag tayong mga nutritional deficiencies that we have already studied in the pharmacology and in your OB, pag ang concern po nito yung mga anemia natin na iron deficiency, folic acid deficiency, vitamin B deficiency, ito ay mga expected po natin na mababa po ang hematocrit. Okay? So low iron, vitamin B, folate, which usually happens ito, di ba? Usually happens ito sa mga abnormal physiologic response yan sa mga pregnant women. That's why they are supplemented with these supplement drugs. So if the client may have the decreased hematocrit concentration, so preventive, so pharmacological management agad, kasi in the phases of pregnancy, there are certain situations or certain period that the pregnant client is expected to have this nutritional deficiency. So expect the result is decreased hematocrit, but it could be prevented. Okay, next po, the client may have bone marrow problems. Okay, pag bone marrow problems po, ito po yung may mga direct problems or injuries sa bone marrow, or specifically direct na yan sa production ng RBC sa bone marrow. So we all know na as what we have mentioned in the previous slide, ang red blood cell, pinoproduce siya ng bone marrow pero nagmamature ang red blood cell once it's already in the bloodstream. So pag nagka-problem si bone marrow, so there's a problem with the production of RBC. So less volume of blood. So that's decrease in the hematocrit concentration. Another po, if talagang ang direct problem is not nutritional and not caused by the blood loss, pero talagang abnormal yung level ng hemoglobin, it is directly associated with the result of hematocrit. Pag abnormal ang hemoglobin, meaning below normal, it is obviously it may also be directed to decrease in hematocrit level. At ang tawag doon ay sickle cell anemia. Okay ha? If it is directed to a problem with hemoglobin, it's sickle cell anemia. So as what we have mentioned in the decrease in hematocrit, the loss of blood could have the decrease in hematocrit. Nutritional deficiency, iron, folate, vitamin B can lead to decreased hematocrit. Bone marrow problems, because we all know in the bone marrow, this produces the red blood cells specifically, and eventually may mature in the bloodstream. So any of these bone marrow and blood vessels pwedeng mag-lead into decreased hematocrit. So sickle cell anemia pag abnormal hemoglobin. How about naman pagka-increase in hematocrit concentration? Usually naman, pag increase hematocrit concentration, ang tawag dyan ay polycythemia rubra vera. Okay. Pag polycythemia, that's CY. Polycythemia rubra vera, usually the blood concentration or viscosity is more concentrated. Yan. Sometimes po, other than hypervolemia and hypovolemia, they use also decrease hemo concentration and increase hemo concentration. So pag decrease hematocrit, this could also identify of using the what we call decrease hemo concentration, and increase in the hematocrit concentration is increased hemo concentration. So pag nadinig yun yung concentration, we're thinking of the viscosity then of the blood volume then. So ulitin natin, pag decrease hypovolemia, pag increase hypervolemia. Another is we have the abuse of drug erythropoietin. Usually po, ang erythropoietin is given para po to manage ito sa mga problems natin dun sa mga high risk for bleeding at high risk po for anemia. So this is usually, from the term itself, erythropoietin, this definitely correct RBC. So pag inabuse naman yan, so the abuse use of this drug of erythropoietin, magka-counteract yung effect. So the counteraction of the effect is, instead of stabilizing the red blood cell, rather it may increase yung hematocrit concentration. So yan naman po yung tinatawag natin for the hematocrit. Now, Probably since it's already 6:15, so I may have first or primarily your break or health break instead of 6:30. We'll have it at 6:15 and we will resume on around 6:30. So you may hydrate yourself, stretch your extremities, and meet your physiologic needs for the meantime for 15 minutes. Thank you very much and we will be back. Salamat po. Okay, so let us now continue our discussion. So now we'll proceed other than with our discussion on the red blood cell, specifically on the hemoglobin and hematocrit. We will now proceed on what is being measured for MCV, or mean corpuscular volume. Um, if we are talking about a problem with the decreased level of RBC, decreased level of hemoglobin, we're gearing towards anemias. Now, in the mean corpuscular volume, usually we measure the size of the cell, specifically RBC, because this matters when it comes to the capacity of the red blood cell to carry oxygen for circulation. Usually, MCV, or mean corpuscular volume, is determined by distribution of red blood cell histogram. If we say histogram, this is usually the number of cells that are sufficient when it comes to the capacity of carrying oxygen. The smaller the size of RBC, the lesser chances of carrying uh, the oxygen to tissues and cells. When it comes to the higher, or the increase in size of the red blood cell, the increase in the size of the red blood cell may mean also a problem with the capacity when it comes to the pacing of distribution of blood. So that's why usually for the mean corpuscular volume, the classification of anemias are identified. So we are referring to the size. So that's why if we have normal mean corpuscular volume, the term is normocytic anemia. If we have decreased MCV, or mean corpuscular volume, this is microcytic anemia. From the term itself, micro, the size of the red blood cell is small. For the increased mean corpuscular volume, we have microcytic anemia. So obviously, the size of the cell, or red blood cell, is increased from normal size. So this is basically, let's have a review. This is basically the consideration why there's a need to have the mean corpuscular volume. From the volume itself, it is measured on the size of RBC. So obviously, kung microcytic siya, the less volume that the RBC may have, specifically in anemia. So in this situation, this could determine also the management of or treatment, specifically on the type of anemia based from the classification in the mean corpuscular volume. So next po, other than the mean corpuscular volume, so we are now 47 in the room. So kanina we have 38. So we are, let's have some interpretations. So very important yon. So the MCV is important in classifying anemias. So pagka mean corpuscular volume, ang normocytic anemia, usually pag normocytic anemia, obviously the size, even though it's normocytic, pero abnormal pa rin siya. So yung size of cell are normal, pero less naman yung RBC at less din yung volume. So this specifically, sabi nga natin, pag anemia, it's less decreased RBC, decreased hemoglobin, decreased hematocrit. Pero when we talk about normocytic anemia, normal yung size ng red blood cell, pero mabagal yung production. So usually, ito po ay mga anemia po sa tinatawag nating anemia of chronic disease. So what do we mean by anemia of chronic diseases? So usually sa mga chances po na mga immunocompromised such as cancer, or those who may have problems with kidneys. So they are the ones that usually secondary effect na ang normocytic anemia. So ano naman po yung tinatawag nating aplastic anemia. So pag sinabi naman nating aplastic anemia, this is a very rare disease usually. So ang usually pag sinabi nating aplastic, the bone marrow, ang bone marrow po is not producing adequate number of new blood cells. Kaya kung for example, if it is needed to have the new red blood cell, which is obviously produced sa bone marrow, pero ang bone marrow po is not capable of producing the new blood cells, that is what we call aplastic anemia. So usually ang mga nagkaka-aplastic anemia, usually they experience nose bleeding. Ito yung mga nagko-cause yan ng mga unexplained bruising, yung pasa-pasa, unexplained bruising. Another is the patient may have headache and fever. So those are mga normocytic anemia. But this could be treated naman now or prevented based from the chronic disease naman that causes anemia. So next naman po, pagka-decrease ang mean corpuscular volume or yung tinatawag nating macrocytic anemia, usually ito ang result pagka merong iron deficiency anemia. So I know you have heard about iron deficiency anemia. This is usually associated sa problem ito or concern expected ito sa pregnancy. Kasi 'di ba, as what we have mentioned during the physiologic changes sa pregnancy, ang blood volume ng pregnant mother ay nag-expand kasi it's not only in the maternal circulation but also so it supplements the fetal circulation. So kung nag-expand yung kanyang blood to also supplement the fetal circulation, nagli-lead yan dun sa anemia. And usually this affects yung iron level. So that's why it's expected pag decrease ang MCB, iron deficiency anemia. On the other hand naman, pagka increase ang mean corpuscular volume or macrocytic anemia, ito yung kulang natin is vitamin B12 at saka folate deficiency. So I hope this could help kasi lalo na for your knowledge in the OB and pedia. So you may have a realization na okay, it's very important pala to know yung level ng mean corpuscular volume kasi ito po, this could be the parameters to specify paano nalalaman ng obstetrician or even the healthcare team kung ito ay iron deficiency, vitamin B12, or folate deficiency. So doon malalaman yan kung ito ay tinatawag natin caused by sickle cell anemia. Kasi maraming ang types of anemia. So this could be validated through the results of the mean corpuscular volume. So very important ito. Kaya usually pag mga pregnant mothers, tingnan ninyo if they are being tested with mean corpuscular volume to specifically identify the type of anemia. Next po. Ano naman po yung RDW? Yung RDW o yung tinatawag nating red blood cell distribution width. Pag sinabi nating red blood cell distribution width, sa mean corpuscular volume, ang mini-measure niya yung size, okay? Yung size ng cell. Pero pag tinawag naman natin doon sa usually kasi pagka ang size ng cell uniform, di ba? Pero there are some instances naman pag sa red blood cell distribution, sometimes kasi pag sinabi nating microcytic, for example, in the microcytic anemia, generally you could see a small size of the RBC. Pero pagka tinawag natin na microcytic, so obviously it's from the increase in size of the cell as according to the large size from the normal size. Pero dito kasi sa red blood cell distribution, there is a variation. There's an equal size. So meaning may small, merong increase in size, merong decrease in size, merong normal size. Ito yung problem. So this may also give us the ang tawag doon if there's a variation doon sa sizes ng RBC, ang tawag doon is anisocytosis. Anisocytosis. So this is an indication of an unequal or a variation in the RBC size. Kanina sa mean corpuscular volume, it can really identify kung decrease, normal, or increase in size. While in the red blood cell distribution, ito na po yung may microscopic evaluation that significantly identifies po yung connection doon sa mean cosmolecular volume. Pag nakita ngayon doon yung point na by microscopic evaluation that it varies yung size, ang elevation po, okay, ang elevation in the red blood cell distribution width or RDW is an indication indicating more variation kasi ibig sabihin more variation in the size of RBC. Usually po yung 3 types of anemia that we mentioned ang mababalidate dyan. Kasi kung for example elevated yung RDW tapos nakita nila from the mean cosmolecular volume nagbabari yung size, hindi nila ma-identify kung hindi nila ma-identify kung sa mean cosmolecular volume magbabalidate ba to kung anong type of anemia, pero nakikita natin kasi na hindi siya generic for an increase in size and a decrease in size. So nagkaiba-iba yung size. So usually ang parameters diyan, if it is elevated po ang red blood cell distribution, it is still related for iron, vitamin B12 and folate deficiencies. So yan din po connected pa rin po sila. So another is usually if the patient has thalassemia, ano po ba yung tinatawag nating thalassemia? Ang tinatawag po nating thalassemia is usually this is the problem with the red blood cells, specifically yung structure ng cells ay different from the this is a blood disorder wherein it decrease the production of hemoglobin sa thalassemia, tapos yung dahil sa decrease in the amount of oxygen sa tissues, usually ito yung mga usually a blood disorder talaga ang thalassemia. Ito yung usually lang na palaging subject for blood transfusion, yung biglang magbi-bleed na lang. So usually ito ay genetically acquired. So usually ang thalassemia ay macrocytic anemia pero ang RDW niya ay normal. So ang elevation lang po ng RDW o yung red blood cell distribution are significant in the iron, vitamin B12, we have the B12 rather, vitamin B12 or folate deficiencies. So going back again to the mean corpuscular, pag normal MCB it's normocytic, pag decrease MCB it's microcytic, pag increase MCB it's macrocytic anemia. So if you wish to identify the type of anemia, pag normal size pero mababa yung number, okay, mababa yung production ng number which is anemia, it is caused by aplastic anemia which is directed to the decreased production ng RBC sa bone marrow, at anemia which is based from a chronic disease. A chronic disease that could be either a kidney problem or a problem with blood disorders that really considers anemia as a secondary effect. So iron deficiency is micro and macro for vitamin B12 and folate deficiency. So kung nagbari naman yung mga size, ayan, iron, B12 at folate deficiencies. At ang tawag doon pag nagbabari again yung sizes is anisocytosis. So thalassemia is a genetically acquired blood disorder pero ang RDW niya ay normal. So we will now proceed naman on the white blood cell. So ano naman po ang white blood cell? Ang white blood cell naman po also called as leukocytes. So kanina erythrocytes po ay sa red blood cell, pero ang leukocytes naman po ay referring to the white blood cells. So ang white blood cells po ay specifically saan siya napoproduce. Usually yan ay it exists in the blood, specifically in the lymphatic system. So that's why ang WBC ay usually our parameter for the type for an infection, okay, and for inflammatory inflammation problems. So on the perspective of the problem with leukocytes, ang decrease in the number of WBC is leukopenia. Okay? So ang increase in the number of WBC is leukocytosis. But I need to correct yung level. Yung 4.5 to 5.5 million po ay sa RBC po yan. So to correct po the level for the WBC, it's usually 4 million to 11. Okay, 11 million. So again, to correct the number indicated on the level of the WBC, it's 4 million to 11 million po ang normal reference natin for WBC. So if there's a decrease in the number of WBC, our medical term that are used for the decreased number of WBC is leukopenia. And for the increased number in the WBC is we have leukocytosis. Now, let us now identify yung interpretation if the patient may have leukopenia and if the patient may have leukocytosis. So, usually po, pag ang patient po or kayo any individual po that you may encounter po ay decrease ang WBC count. Okay, so it's less than 4 million. So usually autoimmune disease medications. Kaya you will, as nurses, you will need to ask kung ang patient niyo ay nagte-take ng any medications that may cause a problem and may cause suppression of the immune system. Pag nagko-cause yan ng suppression ng immune system, lalo na for example, chemotherapy drugs. So obviously ang chemotherapy nagko-cause yan ng suppression ng WBC at immunosuppression kasi nga yung target ng chemotherapeutic drugs, it affects the normal blood count, specifically the WBC count. Yung mga autoimmune diseases po natin, usually ito yung mga cancer, yan that are expected po. Expected na ang kanilang immune system ay very low. At usually ito po yung mga examples na another examples po natin ay yung mga severe illnesses such as sepsis. Sepsis is severe infection, cancer, lupus. Ang lupus po affecting the kidney. The patient may have HIV or that's AIDS and radiation therapy. Ang problem naman with the radiation therapy, nagko-cause din siya ng immunosuppression simply because it affects the normal cells, including the WBC count. So, think of it ha, pag mababa ang WBC, check nyo na agad ang medications, check nyo na agad ang mga autoimmune disease. So, yung mga autoimmune disease, ito yung mga nagkukos ng immunocompromised na disease. HIV, lupus, cancer, severe infection. So, kaya if the patient are diagnosed, expect that the client is having leukopenia. Or if the client undergone a specific therapy such as radiation therapy, chemotherapy, and other usually mga mental health medications, nakakapagpababa yan ng WBC. Kaya prone sila po sa mga concerns natin when it comes to the immune system. So how about naman if we have high WBC count? For high WBC count po, there are two major considerations that we can consider. Ang patient natin ay may infection, the patient may have inflammation, the patient may possibly have leukemia. Pero you may not agad ang leukemia usually yan very very high ang level ng WBC but may still need further examination to validate po yung extent ng leukemia. Pero pag very unusual yung level, too much high yung level ng WBC. So the client will be subject na for ano yan. Will be subject for the test ng cancer of the blood. So alam niyo po ba na ang extreme stress at increased anxiety level ay nagko-cause po ng high WBC count. Kaya imagine ninyo na pag kayo po ay may extreme stress, ang cortisol ay napoproduce. Yung cortisol po usually ang cortisol po ay anti-inflammatory substance ng body. So, pag extreme stress kayo, lalong tumataas yung cortisol, pero nagkakaroon siya ng too much effect sa body. So, can you imagine yung parang nag-take ng steroids na too much from the prescribed? So, di ba it can cause damage also and affects the immune system. So, just the same dito. Pag kayo ay on an extreme stress, usually you are prone to infection, you are prone to inflammatory process. Kasi yung cortisol, instead of normally mag-produce sa body natin to prevent inflammation and infection, sumosobra siya. That may lead you to the defense of the WBC, that could be a basis natin. Kaya usually mga nasa extreme anxiety level at stress, expect mataas ang WBC ninyo. So it could be infection or inflammation. So there could be also an indication po na you need to ask the medication, because there are some medications whose side effect po ay increased WBC count. So nurses, you need to take into consideration medication history pagdating sa WBC. Sa low WBC, you take into consideration mental health drugs, drugs that can cause immunosuppression, drugs that are used for chemotherapy. Ayan. For the leukocytosis, ang i-check nyo naman yung side effects. There are most drugs that may cause increased WBC. So I think this diagnosis or these processes or physiologic processes of the body and toward physiologic processes of the body can definitely guide you na basic yung findings mo, pero it will direct you na ano yung mga possible causes of having this increased WBC. Okay, ayan po. Ito po yung very important then that I will emphasize to each and every one of you. Aside from the WBC of the leukopenia and the leukocytosis, I would emphasize then for the nurses to know the importance of having WBC differential count. Di ba kanina I have mentioned if the complete blood count is with differential count, pag may differential count, mas comprehensive. Katulad sa RBC. Di ba sa RBC, pag common lang po yung yung RBC natin, if with or with differential count, pag without differential count, it's RBC, hemoglobin, hematocrit lang. Pero pag RBC with differential count, sasama natin si mean corpuscular volume, which is the MCV, at yung tinatawag nating RD, yung RBC differential with, yung dalawa. So yun yung tinatawag natin na RBC with differential count. Pagka WBC naman, it's WBC with differential count. Yung differential count, ito po yung 5 types. We have monocytes, we have eosinophils, we have neutrophils, we have basophils, and we have lymphocytes. From these 5 types of the WBC differential, if you consider yung percentage, ang pinakamataas dyan, if you will assess, is yung neutrophils at saka lymphocytes. Yung neutrophils at saka yung lymphocytes, yung neutrophils composed of 40 to 70%, yung lymphocytes composed of 20 to 40%. For you to know, specifically, di ba, pataas yung WBC. So ang question mo, sir, kung mataas yung WBC, ano po ba yan? Infection ba yan or inflammation? So if you have evaluated na mataas yung neutrophils sa differential count, that is an indication of bacterial. Okay, ha? Check the WBC is elevated, tapos neutrophils is elevated. Pag pareho yung elevated, bacterial infection. Ngayon, if WBC is elevated, tapos lymphocytes is elevated also, the person is having viral infection. So, on the other hand, titignan din natin yung capacity in general kung yung severity of infection is higher. Okay, ganito yan. Kung halimbawa, na-identify nyo na, increased WBC, increased neutrophils, bacterial infection. Increased WBC, increased lymphocytes, viral infection. But if you want to know kung ito po ay severe yung infection, check monocytes. Kaya pag elevated din ang monocytes mo, severe viral infection. Kung nakita nyo po yung increased WBC, increased neutrophils, increase ang monocytes mo, severe bacterial infection. Kaya minsan nakikita nyo sa mga diagnosis yung SBI, severe viral infection. Kasi it is supported by the examination results or CBC results, specifically in WBC, of elevation of WBC, elevation of lymphocytes, and elevation of monocytes. Kaya severe viral infection. So, kung halimbawa naman, sir, ang cause naman niya ay inflammation. Example, ano bang mga inflammation? Example, phlebitis, nag-inflame ang blood vessel. Ano pa? Appendicitis, Ayan. So di ba tinitingnan natin kung inflammation, ay nako, suspecting for appendicitis yan. So kung suspecting for appendicitis yan, so suspecting ka kung infection or inflammation. Pero kung suspecting kang appendicitis, ano yung what differential reference ang titignan mo kung if you're suspecting for inflammation of the organ? It's basophils. Pagka mataas ang basophils, tapos mataas ang WBC, confirm. That's a problem with that's definitely a problem with the inflammatory process. Ngayon, next, paano naman po pag asthmatic? Ang asthmatic po kasi, ang asthma po rather ay usually yan based from the attack dahil merong exposure sa allergens. So, usually ang asthma, it could be attested through increased WBC. Sir, paano po namin malalaman? So malalaman po natin yan based from the pag-elevated ang eosinophils at elevated ang basophils. Yung eosinophils at basophils na yan ay responsible for allergic response. Allergic response. Kaya yan ang nagko-control for any hypersensitivity reaction or allergic reaction sa mga asthma, sa may allergic reaction sa gamot, sa food. Pero kung halimbawa nagkaroon nga ng ganong response na may mga hypersensitivity reactions, ay ang titignan po natin ay dalawa. Titignan po natin ay eosinophils at saka basophils. Pag nag-elevate yung dalawa na yan, increase ang WBC, confirm it's related to allergic reaction at inflammation. So pwedeng ang asthma attack nagko-constrict na yung airway passages mo, at even with the hypersensitivity reaction, yun din naman ang effect, respiratory tract. So next po, paano sir pag ang cause naman ay parasite infections? Kung mga parasite infections na yan, ano bang mga example ng mga parasite infections? Anyone? Ano bang example ng mga parasite infections? Class? Can you give me an example of parasite infections? Anyone? Ano po mga parasite, example ng mga parasite infections? Usually yan, pagka affecting, usually one of which is affecting the, affecting the GI tract. Yes, come again?
Pinworm.
Yes, exactly. Pinworm. Any other mga
Tapeworm po,
parasitic
sir.
infection. Tapeworm will do. So yan yung mga common parasite infection. Pinworm, tapeworm, ascaris, hookworms, yan mga parasite infection yan. So I'll check the ano pa? Malaria. Okay? So malaria could be, yes. Ano rin yan, mga parasitic infection din yan. Yan yung mga nakikita ninyo sa mga filariasis, yan. Malaria. Usually ano yan, mga parasite infection. Ngayon, pag mga parasite infection po, usually mga trichomonas yan, mga trichomoniasis, usually yan, mga pwede rin sila mga parasitic infection. So in this situation po, pag parasitic, usually yan, intestinal, mga intestinal parasites, microorganism, yan yung mga na-mention ninyo. Ang result po na titignan ninyo is WBC tapos eosinophils. So pag WBC is increased tapos suspecting kayo for parasitic infection, check for eosinophils. So I hope you are having realizations of having the importance of knowing WBC differential kasi it will really direct us na, for example, tulad nito, foreign substance. O halimbawa, foreign substance. Ano ibig sabihin ng foreign substance? Yung foreign substance that enter the body. Okay, that enter the body. So hindi yun doon. So it entered the body. So the monocytes can be determined on its concern of response of the body pag elevated yan. So let us have the review again. Pag increased WBC and referring to viral infection, elevated po ang lymphocytes. Pagka ang patient po is having hypersensitivity reaction, either food, either drugs, asthma attack, you will check WBC elevation and eosinophils or basophils elevation. Next po is if it's a concern with bacterial infection, WBC elevation, then we have neutrophils. Tapos pagka we are talking about severity tsaka foreign substances, it's monocyte infection. So ayan po, ang laki ng I think will contribute to your knowledge on this concepts. So last for this complete blood count, because the other part of this will be discussed on Thursday. So the complete blood count naman, other than complete blood count component, is we have the platelet count. Okay, for the platelet count po, a count of the number of platelets is thrombocytes. So we have erythrocytes, RBC, leukocytes for the WBC, thrombocytes naman po are for the platelet count. So the number is 150,000 to 400,000. Usually pag platelets po, ang action nito ay definitely clotting. Okay? So usually when the client is a high risk for bleeding, platelet is the one component of the blood that really controls the bleeding through clotting. So in this situation po, if there is a decrease in the number of platelet, the term being used is thrombocytopenia. Decrease in the number is thrombocytopenia. Pag increase in the number of platelets naman po, we have thrombocytosis. So let us now interpret ano naman po yung mga causes ng thrombocytopenia at saka this is single H or thrombocytosis. Ayan na po. So, pag thrombocytopenia po or low platelet count, usually po pag low platelet count, ito po yung risk for bleeding. Usually bone marrow issues, chemotherapy, viral infection. If you will connect it with the WBC, pag ang patient mo ay nagki-chemotherapy, expect mo na mababa ang WBC nila kasi immunocompromised sila. Tapos at the same time, yung platelet mo mababa din. Kaya check for signs of bleeding pag mga nagki-chemotherapy, radiation therapy, at nagtitake ng mga immunosuppressive drugs. Now, pagka thrombocytosis naman, this is considered as high platelet. Ito naman yung risk for clotting. Ang risk for clotting naman natin ay it is caused by inflammation, acute blood loss, or leukemia. So if we will go back to WBC, ang isa sa nag-identify doon na may significant effect pag sa leukemia ay yung high level of WBC. So probably, ang next na titignan ninyo, if you are suspecting for a problem with leukemia, check nyo na yung platelet count. So pag mataas din yung platelet count, so mag-suspect na kayo of problem with leukemia. So the client will be subject for the test specifically to specify problem with leukemia. So okay. So I think the urinalysis, the discussion of the urinalysis will be this coming Thursday na po. So probably we have completed the topics or the discussion of topics for today. So I will stop the sharing.